Hello, myself Dr. Shantakumari, Chief Physician and Managing Director of Mada Ayurveda Hospitals, Thiruvananthapuram, Kerala. Today I want to speak something about the eye disease, glaucoma. It is very familiar to common people even because the number of people suffering from glaucoma is increasing day by day in our country. Really, it is a dangerous disease, and if not treated in time by an experienced hand, it is capable of leading to total blindness. So everybody should know something about glaucoma. Now let us think what is glaucoma. There are different types of glaucoma. Mainly one is congenital one, that is by birth. Then another group is primary glaucoma, which is an independent entity without any other associated diseases. And another group is secondary glaucoma, in which there will be pathology of other ocular disease also. Now I want to talk only about primary type glaucoma. Then before coming to the disease, this treatment of glaucoma, we have to know something about the normal physiology connected with the glaucoma. There are two fluid components inside the eyeball. One is in the anterior chamber, that is the anterior part of the eyeball, just in front of lens. It is known as aqueous humor. It is very thin and purely transparent and circulating one. It nourishes the structures inside the eyeball, and later, after circulating and nourishing, it drains back to the venous circulation. And it is developed, it is produced from the arteries. And after circulation, it gets back into the circulation through veins. That is the normal situation. And in glaucoma, what happens? There will be some blockages to the drainage system, and so that the pressure inside the eyeball increases because of the accumulation of the fluid or blockage of the drainage system. This is the basic reason of this glaucoma. The pressure of this fluid inside the eyeball is known as intraocular pressure or IOP. So increase in IOP is the main symptom. Normally the IOP of this fluid is about 16 to 20 millimeters of mercury. When it goes beyond 20, we have to consider the presence of glaucoma. Then second fluid is vitreous humor. It is behind the lens in the posterior part of the eyeball. It is more or less jelly-like and not circulating as aqueous humor. So from the physiology, it is clear that this glaucoma is more concerned with the aqueous humor only. So the reason is also blockage to the drainage system. Mainly, there are other contributing factors also, but need not go to the depth. Now, let us come to the treatment section. From the physiology itself, it is very clear that the aim of the treatment should be to maintain the circulation of aqueous humor. And because of that, the pressure can be reduced and further damage to the structures can be prevented. How is this possible? In Ayurveda, there are methods for this. For this, extraocular treatments, that is, other than the eye, the treatment procedures done, the structures of the head region is very important because the vessels to the eye or the channels to the eye is not limited to the eye. So different types of procedures to clear the channels of the head region is very important. For this, massage of the head region with the medicated powder, different types of herbal powders is very, very effective. We will say that Shira Udhartan for this procedure. And second one is scientifically modified method of nasal drops. known as nasya. There are different types of nasya, Brahmana or Samana, Virajana, like that. But here the medicines are very important. The medicines should be selected in such a way that it should act on these eye channels of the eyeball, and should be protective in its nature, and should remove the blockages. That type of medicines are selected for nasya in the management of glaucoma. Side by side, Indian medicines also are highly effective and is necessary also. So by these three methods, powder type massages on the head region, and special type of nasal drops, third, selective Indian medicines. By these methods, the unwanted deposits and accumulations can be removed, and the vessels or the fluid running channels can be dilated and maintained. Then this itself controls the increase of IOP to a great extent. Then comes the second step of the treatment, that is to protect the ocular structures to avoid further damage. In this, the protection of retina is more important, because in the later stage of glaucoma, damage or degenerative changes in the retina is the dangerous pathology. So this can be removed or can be treated by appropriate treatment procedures. For that, specially modified procedures such as Tarpan or Ashodan, etc. used. And also in this particular step also Indian medicines are necessary, but it will be different from that of the first step of treatment. So by the second step, we can protect the retina, and we can revive and strengthen the functional capacity of the retinal cells. And by these two methods, we can control glaucoma. But one thing also is to be remembered: even after removing all these blockages and maintaining the circulation, we have to continue the medicine to some extent in order to prevent further attack. Especially if the reason for this blockage is remaining, maybe it's lifestyle or food habits, etc. If it is remaining, we have to continue the medicines in order to maintain the better situation. So by these methods, Indian medicines and nasal drops and head treatments, etc., we can control IOP and thus protect the patient from being blind because of glaucoma. Okay, thank you. We are hearing from Dr. Shantakumari, the Chief Physician of Mada Ayurveda Hospitals, Tirunelveli.